Well, I'm a gastrointestinal medical oncologist. I've been working at Peter Mac for the last 20 years. Well, I think it's important to have a very frank discussion with your team. It might be just surgeons, or it might be medical oncologists or radiation oncologists. You need to know what the extent of the disease is. You need to know what are your treatment options. And for each option, you need to have a very clear discussion with your team about what's the pros and cons of each approach, what's the advantages of going down each approach, what are the potential side effects or complications of each approach, what's the advantages. And they need to give you as much information as possible for you to make an informed decision. It's your disease, you're the captain of the ship. You have to make that decision. And then once you make that decision, be happy with it, and the team should respect that. The whole variety, it can be a whole variety of different choices, but they have to give you enough information to help you make your decision. Our job is to make sure that our patients are fully informed about their disease. Otherwise, we're not doing our job. And I think as patients, right, if they're not happy with their clinician in terms of the level of care or the level of information that they provide to them, then it's their right to change clinician if they can. It's always your right to have a second opinion. We always have patients asking for second opinions, or we actually see second opinions quite commonly as well. So you shouldn't be ashamed or scared of asking for your medical oncologist or specialist to send you for a second opinion. It's always sometimes helpful to have a different set of eyes on your case. That may change things. Often it doesn't, because often the treatment is quite standard across the country. But I think it's for your ease of mind. I think that's quite important to seek that advice.